you doing today?
I'm good. How are you?
Good, thank you. My name is Amy. I'm going to be the nurse doing your assessment today. So go ahead and let me know what your name and date of birth is.
Cassandra Stevens, 11/26/84.
Thank you. And where are you today?
Chamberlain Hospital.
And who is the President of the United States?
Obama.
Thank you. So patient is alert and oriented ×3. Patient is appropriately dressed for the weather. She is well nourished. She has good personal hygiene. She is maintaining eye contact and smiling when answering questions that I ask. She does not appear to be any signs of distress. And I'm going to go ahead and take her vital signs at this point. I would take her heart rate, her respiratory rate, her blood pressure, her temperature, and her height and weight, and assess them. They would all be within normal limits. Can you tell me if you're in any pain today?
Yes, I am.
Okay, and when did that pain start?
It started last night.
Last night? And where's the location of the pain?
It's in my lower back.
Your lower back? Okay, so as far as this pain, does it come and go? Is it constant?
It's been constant.
It's been constant, okay. Is there anything you can tell me about the characteristics of the pain? What does it feel like?
It's just dull.
A dull,
Mhm.
okay. Is it like burning, aching?
It's
sensation?
aching.
Aching, okay. Is there anything that makes the pain worse?
When I walk.
When you walk, okay. Anything that makes it better?
Rest.
Rest?
Yeah.
Sure, is there a certain time of day that you find the pain is worse than others?
When I'm at work.
When you're at work? Okay, sure. So like at the end of the day after your shift? Sure. And then on a scale of 1 to 10, with 1 being no pain and 10 being the worst pain you've ever been in, can you tell me where your pain is today?
Probably about a 4.
About a 4? Okay, that sounds good to me. So the first thing I'm going to do is go ahead and do a respiratory and a cardiac assessment. So I'm going to listen to your lung sounds.
Okay.
You can lift up your right arm for me. Now I'm going to listen to your heart sounds in the 5 locations. We do aortic, pulmonic, Erb's point, tricuspid, and mitral. So I want to ask you a couple of other questions. You said walking has been painful. This is kind of like, is it walking when you wear certain shoes?
Yeah, I'm thinking that might be part of the problem.
Okay, so like, what shoes do you usually wear to work?
Just like these gym shoes.
Okay, gym shoes. Any problems bending down?
No.
How about twisting and turning?
No.
Okay, so any other kind of related like problems with your feet, any sort of prior surgery or past medical history with your feet?
Oh, no.
Nothing? Okay, great. So I'm going to ask you to do a couple of different things for me. The first thing I'm going to have you do is just walk to the wall and back. We're going to assess your normal gait. Sure, so patient's gait is smooth and well coordinated. Her arms move in opposition to her legs, which is normal. The next thing I want you to do is walk, touching your heels to your toes.
Okay.
And go ahead and do that to the wall and back. Good. And now, when you walk back, I want you to walk just on your heels. And now if you could walk just on your toes. Great. Go ahead and sit for me. I'm going to assess some deep tendon reflexes. The first thing I'm going to do is your patellar reflex.
Okay.
Excellent. Now I'm going to do your Achilles reflex. With that reflex, her foot should drop. You're going to go ahead and assess the reflex, and if you don't get it, try it another time with distraction. If it doesn't work the second time with distraction, just go ahead and move on with your physical assessment. So the next thing I want you to do is go ahead and lay back for me. We're going to do the Lissig test for disc involvement. I'm going to go ahead and lift your right leg. Let me know if you feel any pain.
No.
And then I'm going to go ahead and lift your left leg. Let me know if you feel any pain.
No.
Great. And go ahead and stand up for me. So we're going to assess range of motion. Go ahead and step forward for me just a little bit. The first thing I want you to do is go ahead and pretend like you're kicking a soccer ball. And then go ahead and pretend like you're kicking a red rubber ball. Really give it a good kick, like kickball. Good. And then go ahead and remember hacky sack. Do a little hacky sack with your leg.
Okay.
Good. Now go ahead with the other leg. Go ahead and kick a ball, a soccer ball. Go ahead and kick a red rubber ball. And then do a little hacky sack with your leg. Good. So I'm going to go ahead and have you kind of lift your leg up and then just move it side to side against some resistance. Good. And the other leg. Good. Good. Patient has a normal range of motion with strength against resistance. I'm going to go ahead and have you just turn that way and go ahead and touch your toes for me, looking for any scoliosis, any evidence of asymmetry in her shoulder blades, in her scapula, or in her hips. Okay, you can go ahead and stand up for me. Thank you very much for your time. Do you have any questions for me?
No, I do not.
Thank you.